Hi everyone, my name is Anthony Con, and this time I will talk about Ribavirin for chronic hepatitis E virus infection in transplant recipients. Definition: Hepatitis E is a liver disease caused by infection with a virus known as hepatitis E virus (HEV). The virus has at least four different types: genotypes 1, 2, 3, and 4. Genotypes 1 and 2 have been found only in humans. Genotypes 3 and 4 circulate in several animals and occasionally infect humans. Application in medicine. The hepatitis E virus is transmitted mainly through the fecal or oral route due to fecal contamination of drinking water. This route accounts for a very large proportion of clinical cases with the disease. The risk factors for hepatitis E are related to poor sanitation, allowing virus excreted in the feces or infected people to reach drinking water supplies.
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant 8 years ago. Currently, he is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. What does that mean? Since we know that Pete is taking immunosuppressive medication, we should consider this in interpreting his lab results. We know that immunocompromised patients can have problems producing antibodies to the virus. So in Pete's case, it is essential to measure RNA. His lab report shows elevated ALT levels as a sign of liver damage, but negative antibody tests. However, there is RNA detectable in his stool. Pete is suffering from an active, ongoing HEV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently, or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis E lab results.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.
Pros and cons. Pros. China has manufactured and licensed a vaccine capable of preventing HEV infection, although it is not yet available in other countries. Cons. It is a disease that affects other areas of the world, but its prevalence is higher in East and South Asia.
The epidemiology. Hepatitis E virus spreads by the fecal-oral route, especially by contaminated water. Hepatitis E has been shown to occur in epidemics, endemics, and sporadic forms, mostly in the less developed parts of the world. The largest such epidemic occurred in Delhi during the winter of 1955 to 56, following a breakdown in the water supply and sewage systems of Delhi, affecting over 30,000 persons. A similar epidemic of hepatitis E occurred between December 1975 and January 1976 in Ahmedabad city in India. Now, coming to the laboratory diagnosis. Several antibody assays are being developed, mostly based on ELISA methods. First, we will see immunochromatography test. Many rapid tests are commercially available to detect anti-HEV IgM antibody based on the principle of lateral flow ICT. Second, exclusion of hepatitis A and hepatitis B. Exclusion of hepatitis A by negative IgM serology and hepatitis B by the absence of HBsAg and IgM anti-HBc. Third is immunoelectron microscopy. Immunoelectron microscopic examination of patient's feces for the demonstration of aggregated calcivirus-like particles using monoclonal antibodies. Fourth are ELISA tests for anti-HEV IgM and IgG antibody. Fifth is Western blot assay, a Western blot assay for IgM or and IgG anti-HEV. Sixth is polymerase chain reaction for the detection of HEV RNA in patient's feces or in acute phase sera. For the prophylaxis, there are general measures like maintenance of a clean water supply and other sanitary measures. For immunization, vaccines based on recombinant antigens are under development.
Is I applied in Ecuador. Every year, there are estimated 20 million HEV infections worldwide, leading to an estimated 3.3 million symptomatic cases of hepatitis E. Conclusion: Ribavirin as monotherapy may be effective in treating chronic HEV infections. At 3 months course seems to be an appropriate duration for this therapy, though a longer therapy can be given to the heavily immunosuppressed patients and those who still have viremia 1 month after the initiation of therapy.
It contains positive sense, single-stranded RNA and a specific antigen, HEV antigen. Genotypes. HEV has single serotype, however, 5 genotypes exist in nature, which differ up to 25% in their RNA sequence. Only 4 genotypes have been detected in humans. Genotypes 1 and 2 appear to be more virulent. Genotypes 3 and 4 are more attenuated and account for subclinical infections. Clinical manifestation. Incubation period is about 14 to 60 days, average 40 days. Most of the patients present is self-limiting acute hepatitis lasting for several weeks followed by complete recovery. Fulminant hepatitis may occur rarely in 1 to 2% of cases, except for the pregnant women who are particularly at higher risk 20% of developing fulminant hepatitis. There is no chronic infection or carrier state. Epidemiology. Hepatitis E virus is a zoonotic disease affecting various animals such as monkeys, cats, pigs, and dogs. Transmission: it is fecal orally transmitted via sewage contamination of drinking water or food. Epidemics of HEV infections have been reported primarily from India, Asia, Africa, and Central America. HEV is the most common cause of acute hepatitis in this zone. Other parts of the world, temperate climate, HEV is uncommon and usually occurs in travelers coming from endemic zone. The first major epidemic of HEV was reported from New Delhi, 1995, where 30,000 people were affected due to sewage contamination of the city's drinking water supply following a flood that occurred in Yamuna River. China reported more than 1 lakh cases of jaundice during an outbreak in 1986 to 88. In India, HEV infection.
Thank you.